CPT JJ-CPV Introduction 15 or page 15, Part 6.
Place of service and facility reporting continued.
Continue. Okay, services provider in the home by an agency are facility services.
Services provided in a home by a physician or other qualified healthcare professional who is non-representative of the agency are non-facility services.
So make a distinction, right? When an agency provides care in the home, that is a facility service. When an organization sends somebody to the home, that's a facility service. When a particular doctor or other healthcare professional goes independently to a home, that's a non-facility service. And why is this important? Because the payment is different. The payment is more if it's a facility. You see, in this example, you read this example, but at the end, it says, for the facility rate, they pay $213, right? For the non-facility rate, that would be only $170. So the difference is because one is facility services or service, and the other one is a non-facility service. Okay? So that is our theory for today. Now let's do a problem. So ready, set, go. Okay? The problem is CPT JJ-RVA, page 245, exercise 2. And this is level 1 exercise. And it reads like this. Oh, the title is.
Established patient.
And the text reads like this.
Surgery, evaluation, and management. An established patient returns to the physician's office for a follow-up on his hypertension and diabetes. The physician takes the blood pressure and references the patient's last 3 glucose tests. The patient is still running above normal glucose levels, so the physician decides to adjust the patient's insulin.
Okay.
An expand history was taken and a physical examination was performed.
Okay, so that is the evaluation and management case, right? You have to evaluate, you have to code the evaluation, which means the exam, the service that the doctor provides, and the management, and what was it done, right? So we are going to count to 3, so you can pause the video and then give us the answer to this question or this procedure. 1, 2, 3. Okay, the answer is 99 to 13. All the E and M start with 99, right?
Right.
99 to 13 is in our case. That's the answer. Now, if you got that, congratulations. If you didn't get it, let's give you a couple of tips. First tip.
Start with follow-up.
Start with follow-up, and then it sends you to
see hospital services or office and or other outpatient services.
That's where it's going to send you, right? And then the second tip is that you choose what?
Office, other outpatient services.
In the index, right? For the range of answers. You're going to have a range of answers, and then you choose that. Hospital services leads to a different path, right? Because this is not a hospital service because it was done in an outpatient setting. Okay? All right, so the answer is 99 to 13. And you already have a couple of tips. So we're going to count to 3 so you can give us the path to the path to the answer, right?
Right.
So 1, 2, 3. Okay. This is the whole problem, the summary of the problem. This is a surgery, evaluation, and management, right? An established patient. Is it surgery? Why is it surgery? Because isn't it just surgery, evaluation, and management?
Oh, right.
I think you should take the surgery out because this is the red part. It's not surgery.
Okay.
It's just evaluation and management. Yeah, right.
My apologies.
Okay, no problem. Okay, so the section is evaluation and management, and it reads like this. An established patient returns to the physician's office for follow-up on his hypertension and diabetes. The physician takes the blood pressure and references the patient's last 3 glucose tests. The patient is still running above normal glucose levels, so the physician decides to adjust the patient's insulin. An expanded history was taken and a physical examination was performed. Okay? So there's only one code, and the code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to follow-up.
Go to follow-up. And in parentheses, send you where?
In brackets, it shows you see hospital services and office and or other outpatient services.
Right. So you go to office and other outpatient services, right?
Right.
Okay, go there.
Then you go to that one, office and other outpatient services.
And then you choose from that.
And then you choose established patient.
Because in the text it tells you it's established patient, right?
Right.
And so they give you a range. They give you a range according to what the history and the decision making is going to be, right? So you have to analyze all those codes in that range. So the code 1 through the tabular is checked like this.
You first go to tabular.
Go to the tabular and you're going to analyze all the codes in the range, right?
Right.
So the first one. Why is not the first one?
First one is not because this is office or other outpatient visit. Minimal. 5 minutes are spent.
Right. And this is not minimal, right?
Right.
All right. The second one.
99212 is problem-focused history, problem-focused examination, straightforward medical decision making. Not one of them is actually possible.
It's not an expanded history, right? It's a focused history.
Right.
So that's not it. The next one.
99213 is expanded problem-focused history.
That's good.
Expanded problem-focused examination. And medical
examination, that's good.
And medical decision making of low complexity.
Adjusting the patient's insulin, which is what the doctor did, qualifies as a low complexity because all the doctor did was just keep taking insulin, right?
Right.
And so that is not complex. So that's why it's a low complexity. So the answer is 99-213, right? Because it has all the elements for our text. So again, the answer is 99-213, right there. And don't forget to visit our website and also
you can subscribe to us on YouTube by clicking here for our new medical coding videos.
Okay, and when you click the red button, you will get
up to 3 videos every day that we make. ICD-10, CPTs, all that is needed to pass the medical coding certification exams.
And don't forget to visit our website and subscribe to our videos then. Thank you.
Goodbye.
Bye.